Good. Hello and welcome to the webinar, Sharing Pathogen Data in Ebola and Hantavirus Outbreaks, Implications for Pathogen Access and Benefit-Sharing. I'm Adam Strobejko. I'm a legal advisor and researcher with the Governing Pandemics Initiative at the Global Health Center, Geneva Graduate Institute. The sharing and governance of pathogen data has been a key topic in the ongoing discussions in the Intergovernmental Working Group on the WHO Pandemic Agreement, tasked with the negotiation of the Pathogen Access and Benefit-Sharing system, PABS for short. Only when the PABS is negotiated and adopted by the World Health Assembly can the pandemic agreement enter into force. The task is complex. PABS discussions tend to focus on open access versus registration-based databases. Some countries prefer openness, arguing that unrestricted access maximizes the speed of scientific exchange, collaboration, and ultimately the development of health products. Proponents of registration, on the other hand, argue that it creates a traceable link between data use and the enforcement of benefit-sharing obligations. Recent outbreaks, however, demonstrate that data can be shared in multiple ways, including through public fora. Moreover, data can be shared on open access basis, but with temporal restrictions on its use. The question remains how the PABS system can account for these modalities of data sharing and learn from recent outbreaks. So today's webinar aims to create a space for an exchange with experts who work directly with pathogen data and who shared it or managed it during the recent Ebola and Hantavirus outbreaks. Therefore, we are delighted to be joined here by the following panelists. Emma Hodcroft, Assistant Professor at Swiss TPH and co-founder of Pathoplexus. Chaoran Chen, Scientific Software Engineer at the Department of Biosystem Science and Engineering at ETH Zurich, also at Pathoplexus. Isabella Ekerle, Full Professor and Director of the Center for Emerging Viral Diseases, Geneva University Hospitals, HUG. Stephen Kanyerezi, a bioinformatician at the Central Public Health Laboratories, CPHL, in Uganda. And Eddie Luzamaki, research physician at the Institut National de Recherche Biomédicale, INRB, in the Democratic Republic of the Congo. Before we begin, I want to mention some housekeeping rules. So this is an academic space. We encourage honest and constructive debate. And we will start with a round of presentations by the panelists, followed by a moderated Q&A. Once in Q&A, I will ask you to put questions in the chat so that I can direct them to the panelists. Finally, please note that this event is being recorded and will be shared on our YouTube channel. And please pay attention to the chat where members of our team will share further materials related to this webinar and our activities. So without any further ado, Emma and Chaoran, the floor is yours for a presentation. Thank you.
Great. Thank you so much, Adam. Hope you can all see my slides. So yeah, thanks for this opportunity to present Pathoplexus and our response to the two recent outbreaks. Pathoplexus is a rather new organization founded in August 2024 by a wide group of scientists and public health professionals who have been working with pathogen sequence data for a long time in terms of conducting research, developing tools and IT infrastructure, as well as generating insights for public health. And we founded Pathoplexus to address two major challenges we were experiencing. The first area is about the rapid and equitable sharing of DSI. So on the policy side, we developed data use terms to balance the needs and incentives of science and public health. And on the more practical side, we wanted, on the one end, to make the platform really easy to use. Because during an outbreak, people generating the data in labs, in hospitals, they don't have the time to spend hours to figure out how the system works. And also, of course, it is nowadays fundamental to make the data machine accessible if we want the data to be analyzed quickly with automated tools and nowadays also with AI. The second area is the transparent governance. Pathogen sequence data are just a critical resource for global health. And so for us, it was really important from the very beginning to make sure that this is transparent, well-governed, and long-term sustainable. We therefore formed Pathoplexus as an association with members from across the world. We have at the moment 32 members from different regions of the world, as the members have real power. So they can decide, they can make real decisions, they can elect the executive board, which consists of 5 members from 5 different continents. And also we make all of our statutes, terms, guidelines, meeting minutes, annual reports, financial statements, all publicly available on our website. So when you upload data to Pathoplexus, you have the choice of 2 data use terms. You can upload the data with the open terms, and under these terms, sequences can be used freely for public health and academic publishing purposes, and we immediately forward the data onwards to INSTC, so to ENA, GenBank, and DDBJ. The second option are the restricted use terms. Here, there are some limits on how the sequences may be used. But importantly, though, the data become openly accessible immediately. Everyone can see the data, can download the data, and they can also reshare the data as long as they are kept under the same terms. And after 1 year at most, it can also be shorter, the data become open and they get submitted to INSTC. So with the restricted use term, we aim to balance public health response with academic incentives. The terms fully allow the data to be used for public health and open science during an outbreak. So for example, the data can be used for government or public health reports. They can be analyzed openly, be discussed, be shared with public health agencies. You can discuss them in blogs, on social media. You can have a press release. You can talk about them in press conferences, in national or international committees. It can be used to build tools and websites, etc., etc. What the terms do not allow, though, is using them in publications or preprints where they are the focus of the work. Many people who generate the data are also academics. And there, the publications are really important part of the credit system and really important for their career. So if we want people to rapidly share the data, we need to make sure that they can also be used still for those academics who generate the data onwards or later on for receiving the credits. And the distinction here matters because public health and science and academic publishing in particular work on very different timelines. Public health actions need to happen within hours or days, whereas publishing a paper can easily take at least weeks, usually months, or even years. One area our terms do not explicitly cover is the development of vaccines and other products. Pathoplexus really focuses on public health use and academic credit. We believe that commercial use is governed under existing laws and requirements, although we understand this is not very clear at this very moment. And we believe that this is ultimately the responsibilities of manufacturers to ensure that they are compliant with the terms, with the regulations, and of course, to be safe, they can consider contacting the data submitters. Ultimately, we are awaiting the outcome of the ongoing PABS ICWIC discussions, and we are committed to be aligned with them. With that, I pass on to Emma.
Thank you so much, Karan, and it's a pleasure to be here. I wanted to just focus a little bit now on one of the focuses of this webinar, the 2 recent outbreaks for Andes virus and the Bundibugyo Ebola virus that unfortunately have so recently caused so much disruption in the world. And we've added these just recently to Pathoplexus. For the Andes virus, we added this on the 9th of May. For Bundibugyo, added on the 15th of May, the same day as the outbreak was announced. And we added these incredibly quickly in just the matter of hours. For Andes, we had the first sequence uploaded the next day. For Bundibugyo, we actually had it available on Pathoplexus while the sequencers were still running. So there were no sequences available yet, but as soon as those were available, those were uploaded to Pathoplexus on the 18th of May. We now have 10 antivirus sequences on Pathoplexus, 9 of which are restricted use, and 123 Bundibugyo Ebola virus sequences on Pathoplexus, all of which are restricted use. And these mostly come from DRC, where the outbreak is based, but also a sequence from Uganda. Next slide, please, Karan. And importantly, we don't just, one back. Importantly, we don't just have the sequences that have been directly submitted to Pathoplexus. We also pull in data from INSDC, so from GenBank and ENA. It's always clearly marked that this is where that data came from, but it means that on Pathoplexus, there is one place where all of the available genomes can be found and downloaded, where they are marked clearly as either restricted use or as open. Next slide, please. And I wanted to just highlight how some of this data has been used, because restricted use, as Karan already showed, was explicitly designed to enable that public health and open science use. It's not meant to stop science. It's not meant to stop public health, quite the opposite. So just to give very brief examples of some of the ways that the Andes and Bundibugyo data has been used, we've seen many posts on an open analyses on virological.org. We've seen open and updating phylogenetic analyses and open sequence comparison tools, for example, NextStrain pictured here. And we've even seen an open, freely available primer scheme that has been developed by the Primal Scheme Labs that is completely free and open, that's to help with sequencing further Bundibugyo samples. So those are some of the examples how this data can be used, even when it's under restricted use terms. Next slide, please. I also just wanted to briefly do a comparison showing how the current Ebola outbreak and the Ebola outbreak last year, the Ebola Zaire outbreak last year, that have both been shared on Pathoplexus, how that data sharing compares to previous Ebola outbreaks. Now, I want to be very open here and acknowledge that, of course, there are a lot of things that influence how quickly sequences can be shared. And here we're showing the number of genomes available from the day since the first genome was collected. And all that we really wanted to highlight here was to just show that that outbreaks where the data has been shared on Pathoplexus, that data has been shared in exactly a very comparable timeline to data that was shared in previous outbreaks, and perhaps even a little faster. But we think that's just important to keep an eye on. We don't see any indication that people are hesitating to share data on Pathoplexus. And in fact, we hear quite the opposite from submitters when we speak to them, that knowing that they can't be scooped on publications actually makes them feel very comfortable sharing. Next slide, please. We've had a lot of attention in the past month or so because of these two outbreaks, but as Karan mentioned, we launched Pathoplexus in August 2024, so this is far from our first rodeo, and we've actually had many direct submissions so far, so over 16,000 direct submissions. Of course, as I mentioned, that is augmented on the website with the publicly available genomes from INSDC as well, all very clearly marked whether they come from GenBank or whether they come directly to us. Many of those are submitted as open. People just find data. There's an easy way to submit data that's very straightforward, and it becomes available immediately, even while it might take a few days or weeks to become available on GenBank or ENA, simply because the systems are a little bit slower. But of course, plenty of data has been submitted as restricted use as well. Notably, plenty of this has been made open, either because the 1-year time has elapsed, but very often people make it open when they publish the data. They really are keep having it to be restricted use just while they get that publication out. And after that, they are more than happy to make that data open and for it to be used in other publications. Next slide, please. I also wanted to just briefly highlight how this data looks when you look at it on Pathoplexus. So this is just opening up the Bundibugyo virus view and clicking on one particular sequence. And as you can see, it's very clear that this data is restricted use. It's very visible in this yellow banner, and it has a link to how the data can be used in more detail in our data use terms. We always make the authors and their associations very prominent, and you can see a lot of information about when the sequence was gathered, how it was sequenced, where it's come from. And we also show important things for scientists. For example, here you can see the number of amino acid substitutions from the outbreak founder. To some of you, that may sound like Greek, but these are the types of things that outbreak investigators, it's very useful for them to see very clearly. And of course, we're happy to provide links so that you can look at this data yourself. Next slide, please. So just to close, with Pathoplexus, we do believe that we have come up with a way to align the incentives between fast sharing for public health use and allowing people to feel protected against having that first publication scooped by someone else. We support submitters by making them feel safe in sharing data quickly and explicitly allowing that data to be used for public health and for scientific knowledge in an open sense so that we are not placing any restrictions there. We're simply protecting authors' rights that they put a lot of effort, especially in outbreak scenarios, in gathering, sampling, and sharing this data. And it is right that they get credit for the publication on that before other people can publish on it as well. But we want to be really open about that. Of course, we are focused on the academic sphere, as Caron said. So the questions of commercial benefit sharing are still very much unanswered, and the landscape is very complex. It involves a lot of different protocols, a lot of different laws, and it is time consuming to try to navigate those and to reach out to submitters. So we recognize that's not a great long-term solution and that we need a better and more clear way to make sure that equity and benefits are guaranteed. And this may still be something that might disincentivize sharing, the fact that people might still feel unclear about how the benefits may come back from sequences that they share. We would like to posit that, of course, perhaps the Pathoplexus framework could be extended and modified to also include commercial benefits. However, that may be decided by the larger IGWIG committee, but we hope that it might be a way that data could still be used for public health and for this important open scientific analyses, especially in outbreaks. Next slide, please. And with that, I'd just like to thank you so much for allowing us to speak. If there's any questions we don't get to answer today, please do reach out to us at hello@pathoplexus.org. We monitor this email inbox closely and we try to respond to any requests as fast as possible. Thank you guys so much. Happy to take questions in the Q&A.
Thank you very much, Emma and Charan. That was so exciting to follow what was happening on Pathoplexus, how you enabled the sharing. And I already have some follow-up questions. I also see participants have them in the chat, so monitor the chat because it has some rich discussions already. But now I wanted to give the floor to Isabella Eckerle, who will talk about how the sharing of Hantavirus and the Andes virus was conducted on the Swiss side. Isabella, the floor is yours. We can share the slides for you as well, so it should.
Isabella, I think you are muted.
Yes, I think you're muted, and
Okay.
if we could have the slides in the full screen mode, let us just put them on, and you can just tell us when you wish to move to the next slide.
Okay, perfect. Thanks a lot. Yeah, so thank you very much for inviting me to this webinar. So we have actually come across a lot of questions about data sharing for the Andes outbreak. That is already, a bit out of the media, but was still quite intensive for us. So next slide, please. I would quickly wanted to introduce you who we are, so you understand why we were doing this work. So we are our Center for Emerging Viral Diseases. It's a joint institution between the University Hospitals of Geneva and the University of Geneva. And our mission is to provide expertise in clinical management, diagnostics, and translational research. We have a strong public health mission, and we have a lot of partnerships with national and international organizations. And among several other functions, we host the Swiss National Reference Laboratory for Emerging Viruses. So that means we have the Public Health Laboratory for Switzerland, which is mandated by us to the Federal Office of Public Health. And we run a WHO Collaborating Center for Epidemic and Pandemic Diseases. Next slide, please. So this is just a quick snapshot of this Andes Hantavirus outbreak. So you see that on 2nd of May, so just focus on the red circles, there was a notification of a severe acute respiratory illness on a cruise ship. And then, well, there were several other events happening. So there was a very early on the suspicion already from South Africa that it is hantavirus. And then if you look at the second red circle on the in May, so a few days later, you see that in Switzerland and South Africa, the Andes virus was confirmed. So next slide, please. So what has actually happened in our center? And first of all, in the upper part, you see all the people who actually did the work and were really hands-on for this case. So on the 4th of May, there was a symptomatic patient who was on this ship, but left earlier, who presented at the University Hospital of Zurich. And they had the suspicion, of course, that he may be infected with whatever is going on this cruise ship, and had sent the samples to us, as we are the national reference lab for such exotic and rare viruses. So the sample arrived in our laboratory 1 day later. And we could identify already the Andes virus by a specific diagnostic assay. So this is an assay that does not only tell us it's a hantavirus, but it also tells us which type of hantavirus, but not the sequence. So we could only say, yes, this is a hantavirus, and yes, this is Andes. And then in parallel, we also conducted metagenomic sequencing. So that was done in Geneva, but also at the Institute of Medical Virology, where that patient in Zurich, where that patient was actually hospitalized. And then together we did a data analysis of our sequencing results. And and that all happened within a week. So the patient presented the 4th of May, that was a Tuesday. And on the 8th of May, so that was a Friday afternoon, we had the full genome available. And then we were wondering what we are doing with this data now, since it was a Friday and the whole world was waiting for them. So basically, we decided to make this sequence publicly available on virological.org. So next slide, please. So what is virological.org? So this is really a discussion forum for experts. It's for pre-publication sharing of pathogenic virus sequences, and it's publicly available. So everyone can read, can download. People can also post. They have to register, but it's not restricted. And so we made this post with a quick explanation what we did, and also a download to the sequence that was analyzed in both sites in Geneva and in Zurich. And we were quite confident. So the viral load was quite high of that patient. It was high quality results. We had a good coverage and could confirm the sequence from 2 institutions. And that was actually happening on Friday afternoon. So everyone could access the sequence. And it was really our decision to do that immediately before the weekend and not sit on these data. Why did we choose virological.org? First of all, because it's publicly available. Second, it's immediately visible after submission. So some other platforms like GeneBank, they do a quality control, or it takes some days. So it was clear in the urgency, we need to have something that we post and that is immediately open to everyone. What about other options? GeneBank takes a few days. As I said, Pathoplexus unfortunately did not have the hantavirus option on that day. So that came just a little bit later. And GIS8 was no option because there's no database for hantaviruses. What is the disadvantage of sharing? So Emma mentioned that already. So for those who are not scientists, just to explain, scientific publications are the major incentive in research. So the more and the better publications you have, the more likely you are progressing in your career and get research grants. And I think we can argue if that is a good way or not, but that's the world we live in. And especially for young researchers, having publications is really important. However, these different databases, they have different structures to protect publication rights. So for example, with virological.org, the sequence is not really protected. And we also saw that people a few days after that contacted us and said, oh, by the way, we wrote a paper with your sequence. Do you want to be an author in the middle? So this is something that can be quite unpleasant, especially when you want to publish yourself or you want to work with other people. And that is really, a difficulty, because on the one hand, you want to make these data public because they're very important for public health. But on the other hand, of course, you also want to have credit, and you may not have the competence to do a huge bioinformatic analysis over the weekend, or you're a small group, or you need help of others. So it's really posing an issue to the people who are in the scientific community. Next slide, please. But more important, so why is rapid and public sharing of sequence data so important? So in this case, I mean, the whole world really wanted to know which virus it was. And what is also important to know, so Andes is the only hantavirus that can transmit from human to human. So really knowing that it is Andes and not another hantavirus was very important for the public health response. Second, we are a national reference laboratory. So for us, knowing if our diagnostic assays work, it's essential. So that's really the first question we have with every outbreak. Do we have the right tools if a patient comes up? Our PCR, is it able to detect this strain? And for this, you need the sequence information. Otherwise, you will never know if your assay is working or not. As I said, it's very necessary for public health risk assessment. So which virus is it? What is the transmission? What is the risk? What is the risk of the disease? But it's also necessary for clinical management of patients, because in this case, there is no specific treatment, there's no specific vaccines. But we have many other examples during COVID or for other outbreaks where really knowing with which strain a patient is infected can guide clinical management. But also, and this is really an important point that is becoming more and more relevant, the rapid sharing of the knowledge on such an outbreak is really important to fight the infodemic, because we saw that, and it is becoming more prominent with every outbreak. Every little event, immediately there is a flood of misinformation, of wrong information, of fake news, and people are scared. So you need to get this fake information out of the world by saying, this is what we have and this is what we know. Next slide, please. So what did this Swiss under sequence tell us? So first of all, we could confirm it is really under. So what our diagnostic PCR assay told us was correct. Second, the virus was quite conserved, so it was not so different to the viruses we know already. So remember, this is a known virus that is known since many decades. It's nothing new. So we could check, okay, the diagnostic assays that are available, they will be able to detect this virus. And that's very important when you consider the many, many countries around the world who were receiving these people coming back from their travel. We could also show that all the segments, so this is a segmented virus, so that means the genetic information is found on 3 pieces in that virus. All 3 segments are highly similar to known viruses from the endemic region, from other human infections that were already observed in 2018. So that was quite good, because we could really say this is nothing new. We are not dealing with a new pathogen. We are dealing with a pathogen that we know, and especially the colleagues from South America, they have a lot of experience with this virus and they can guide us. There was also no indication of reassortment. So for the non-virologists, that means that different virus strains exchange some of their segments. So you may have one segment from lineage A and another segment from lineage B, which could give other characteristics to this virus. So also that was not the case in this in this pathogen. And then also because it was so similar to known strains, we could assess that at least we have no indication for any major changements in the virus biological properties. And that was a very important message to give very early after we had that case, to say, okay, we have experience. There are people who know these viruses. It's very similar to the viruses we know already from the endemic region. And that is a very important part of any outbreak response. So next slide, please. Then over the weekend, WHO convened a group of people who also, so of everyone who also contributed sequences, because of course this activity was going on in many places in the world. And what we realized, depending on which sequencing technique you use, what the quality of your sample is, but also depending on the bioinformatic pipeline, you may get very small differences in the virus sequence. And in the end, it may look like you have different strains or different variants of the same virus, but it's not really the case. It's just an artifact because of the different ways how you can analyze such data. And then what we did a joint analysis from the raw data again, based on the same methods, on the same bioinformatic. It was quite an intensive work with in a really very collaborative effort. And we could show that all the sequences after really doing this curated analysis are very similar. And that was actually also very important to understand a bit more this outbreak. So next slide, please. Because what we could say, there could be 3 scenarios. So either the first patient was infected and then spread it to other people on the ship. It could have been that there was a mouse on the ship or some urine contamination and everyone on the ship got it from the same source. Or there could be a third scenario that all these people traveled in endemic areas and they all caught this infection independently from different mice or different exposure. So next slide. So this we could rule out because the viruses were, So the third one we could immediately rule out because the viruses were very similar. The second one, we could not immediately rule it out based on the sequences, but when you take the epidemiological data into account, then, and you combine them with the knowledge on the sequence, then we could also say scenario 2 is very unlikely. So in the end, we came up with scenario 1. And just by sharing these sequences, having these sequences available, we could very early say this is probably really an event where one person got, or 1 or 2 people got infected in the endemic country, and then they spread it to their other passengers on the cruise ship. And this is just one example what you can really do with sequences. But for that, we need to see the sequences. We need to know that they exist. And you would never be able to do some kind of analysis if everyone keeps their sequence secret on their computer and everyone aims for their own paper. You would never get this kind of analysis in such a short time. So next slide, please. So this is the many people who are involved in this work. And I think especially this writing group led by or convened by WHO and led by Gustavo Palacios was really crucial. And it was an amazing teamwork to work with all these different colleagues and reanalyze our data and bring these data together for a joint report. And with this, I thank you for your attention.
Thank you very much. Super interesting how different categories of data work together and the possibilities offered by open sharing. And now I want to give the floor to Stephen Canieresi, who submitted the Bundibugyo sequence using the restricted use modality. Stephen, the floor is yours.
Yes, thank you, Adam, and thank you for the invitation. My name is, hope I'm audible.
Yes, you are audible, but we see you under 90 degrees.
Oh, sorry.
So if you,
Let me
it's
just
okay, but yes, but I think
hope that's fine now.
Yes.
Okay, thank you. Yeah, so yes, I will introduce myself. Yes, I am Stephen Canyeres, a bioinformatician from the Central Public Health Laboratories. And I will be taking us through a bioinformatician's perspective on pathogen data sharing. My role as a bioinformatician at the Central Public Health Laboratories, I support genomic surveillance in outbreak responses, as well as routine genomic surveillance. I also work on an array of pathogens, that is bacterial and viral. So what happens? Sorry, just a moment. So what happens? So my role as a bioinformatician begins from the time. Begins from the time sequencing data is generated until to the end that public health actions are put into action. So here we can see once the once data is generated from sequencing, I as a bioinformatician, I start with quality assessment up the end that we produce high quality genomes that are later shared. However, besides sharing, there are several other analyses that are performed. And here, what we are looking at is to understand transmission networks. Here we look at identifying clusters, links, and any other spread that would have happened within the community. Then we also determine rather detect variants. We monitor the different changes and variants within the community, as well as track trends and inform decisions. All these together, they support outbreak response. What happens to pathogen data? So yes, when we look at pathogen data, let us not only think about the sequence that is generated. However, this data moves a long way from the time this patient sample is collected. So after a patient sample is collected, we have the DNA extracted. We have several polymer PCR reactions that are performed. Then and up to the time this sample is sequenced, and we have bioinformatics analysis performed. However, while doing this, we look at the national benefit comes first. So here data are used to inform outbreak response, as well as guide public health decisions and protect communities. And after the national benefit, then we look at the global collaborations. And through these global collaborations, we make better findings that protect the whole community at large. And while doing this, we do this under the umbrella of trust and fairness. So why would we want to share our data openly? First, we need to detect and monitor cross-border transmissions. The other thing is we would want to compare outbreaks across countries. So you want to understand how this virus is evolving or spreading in different settings besides our own local settings, as this is important to set up the necessary strategies to prevent to control the spread of this virus. And also why we need to share this data openly, it will improve diagnostics and surveillance. We cannot design diagnostics where we look at data that is only within our own countries. Therefore, we need to adapt data from different countries so that we improve on diagnostics. So we also need to support vaccines and therapeutic development, as well as enable faster global public health responses. So remember, pathogens cross borders, and therefore sharing genomic data helps all countries understand, prepare for, and respond to outbreaks together. So therefore, it is very hard for any country to understand an outbreak in isolation. And I would think that is the main goal of us sharing this data openly. Why would unrestricted sharing? Why would unrestricted data sharing be difficult sometimes? So there are issues of patient confidentiality. So even pathogen genomes can sometimes reveal sensitive information when combined with metadata. Secondly, there's issue of recognition and benefit sharing. Remember, scientists and laboratories invest a lot of effort in generating high quality genomic data. Besides, this effort does not rely only in physical effort. We also look at the funding and as well as time that has been spent. And with benefit sharing, ever there is a question, if we share this data, how are we going to benefit? That's a very big question that is asked by anyone who is to share this data. Thirdly, we look at the national responsibilities. Why sometimes it's difficult to share this data immediately. Countries might want to validate the results from the findings, as well as shape the communication that is accompanied with this genomic data. My perspective, personally, I would strongly support rapid sharing of pathogen genomic data because it improves outbreak response for everyone. However, this openness should not come at the expense of fairness. So therefore, whoever is going to use this data later should put into consideration of the local scientists who generated this data. That is local scientists as well as these laboratories, because there's a lot of time they spent. And besides that, when we look at collaborations, we need to put into consideration of local capacity building. And I would end up saying that from my perspective, the goal is not choosing between open or restricted data. The goal is creating a system that enables rapid sharing while ensuring trust, fairness, and equitable benefit sharing. Thank you.
Thank you very much. Without any further ado, I will give the floor to Eddie Luzamaki, who will also bring the perspective of the DRC and of the sharing, also under restricted use terms. And I can also say that Eddie will have to leave a bit earlier. So if you have questions directed to him, please share them in the chat so I can direct them to him immediately. Thank you. Eddie, the floor is yours.
Thanks a lot. I hope you can see my screen.
You see it? If you could just make it in the full screen mode.
Okay. Thanks a lot for this opportunity which is given to us to share our experience, and especially in this challenging Bundibugyo virus outbreak. And I remember when the outbreak occurred, we were discussing on being prepared against the Hantavirus outbreak that was described earlier. And just to be in the context, we know that Ebola virus was described first in the 17th, and even though we had good clinical characterization, but we had poor genomic because it was the period where the Sanger experiments were designed for the first time. And for many of those diseases, the virus were named according to some geographical patterns like Marburg or CCHF, Sudan virus, and etc. So nowadays, I will skip the part of the taxonomy, but we can see that the taxonomy has evolved a lot, and we know many filoviruses, and they are responsible of many outbreaks worldwide, and especially in Africa. And now we are dealing with the Bundibugyo outbreak, for which we did not expect to have an outbreak right now. We were most prepared to fight against the Zaire strain, which is now called Ebola virus. And we had just two experiences in the past. But right now in 2026, we had alerts coming from the northeastern part of the country, bordering the Ugandan country. And the cases were first thought to be Ebola Zaire. So that's one of the factors that led to this delay in the diagnosis. But as soon as the samples were shipped to the INRB on the 14th of May, we've been able to confirm 8 out of the 15 samples that we received, and that helped directly to dive into the sequencing. And after the sequencing, we've been able to see that this was a new spillover, which was different from the past outbreaks. And I remember that same day, I discussed at 6 a.m. with colleagues from Africa CDC. So there were also colleagues from Uganda online just before the outbreak confirmation, and we already gave a huge suspicion. So during that time, sequencing was ongoing, and we had already suspicion that it could be either Sudan or Bundibugyo. So that allowed also colleagues in Uganda to rapidly capture Congolese citizens which were sick, and that's also how they've been able to confirm rapidly the outbreaks, and the same also in DRC. And for the first time, the WHO General Director declared a public health emergency of international concern before to consult the committee, given the situation, which was really concerning. And after that, and I think Emma told about that, we did a rapid post so that every scientist could be aware of what was going on. And as I said earlier, we worked together with colleagues in Uganda to do this first post. And I think you can see the genome that was submitted on Pathoplexus by colleagues from Uganda. And the two first we generated out of those first those 8 first samples which were confirmed. And definitely we could here establish that it was the same outbreak ongoing in DRC, in the Ituri province, and also in Uganda. So without sharing data, without discussing with colleagues, it would have been difficult to rapidly establish that. And after that, we've started updating our analysis and also updating the genome so that beyond discovering the origin of the outbreak, we could then be able to track how the transmission are occurring on site. So to be in context, this outbreak is occurring in a very dense populated area with some armed conflict still ongoing. So that makes really the response difficult to be implemented as opposed in Uganda, for example. But from our side, I think we've been really in touch with Emma and the Pathoplexus team, and thanks for their support. So rapidly, we've been able to keep updating, so to submit the first genomes and keep updating. And she just presented that we have now 123. So 122 are from DRC, and we are still working on uploading more. I think there are some which are now going into validation process and metadata checking. Once this will be ready, I think there will be a batch of 50 to 60 that will be uploaded again. And this is just an example of the builds we are working on with the Next-Train team, so that people can also see directly the analysis, and also the links to the Nextclad can allow us to directly check or quickly check if the genome which is generated is still the same outbreak or if this is a different one. So I just remind here that we have a big challenge with this outbreak. First, there are no vaccine, neither vaccine nor treatment validated to date. There is a trial ongoing. The population is really dense and in movement. And there is an issue with the security context, which makes difficult to establish countermeasures at some of the areas. But at the same time, sometimes we may also hesitate to share the data regarding also some bad practices which may be ongoing that will avoid to provide credits to the data generators. So despite that, I think we should preach by the good example, which is to still continue sharing the example. And we can see from this presentation or this session that this allowed us to identify at least the outbreak origin, to rapidly implement public health measures, to do this cross-border surveillance approach, and also to improve the diagnosis, which is something we are right now working on, and also the different medical countermeasures approaches which are being implemented. With that, I will just need to thank all the team and all the partners who have been working beside us to be able to first understand, and we hope that we'll continue to work together to be able to win this outbreak. Thanks for your attention.
Thank you very much. And I will take the chair's privilege to ask you the follow-up question, since you have to go shortly. When you shared on Pathoplexus under the restricted use, so just for everyone on the call to understand, the data is openly accessible, but there are restrictions put on the use of the data. So what are your expectations as a scientist of what happens to this data? And would you, Eddie, would you consider, is there any need for further rules on the, either through the government or international rules that could build more trust in this area from your perspective?
Yes, thanks for this question. And I think Stephen somehow addressed that question. So when we, and even Emma, when we share the data openly, is for everyone to be aware of what's going on. And also we are open to different collaborations. I think Isabella showed a great example on how, with the contribution of different people, we've been able to better characterize an outbreak. And trying to do that by ourselves in this century is very limited. And also, I think we keep it restricted because we've seen some unfair practices where someone can just grab your data, make some analysis, and get credit for that. And we know that for academics, journals are somehow strict when it comes to publications. So imagine that you generated data and you want to publish that, but those data have already been used by anyone else, so it lose the value. So our aim is really to fight against the outbreak, because this is an emergency. People are dying. We really need to have diagnosis. We really need to have treatment. So that's why we first share that, to allow us to have tools to fight against this outbreak. Over to you.
Thank you very much. And just a quick follow-up. I also am aware of some of the reporting around the use of samples. So you mentioned the Zaire and the Sudan Ebola outbreaks, and apparently for some of the R&D work, the research still relies on samples from earlier outbreaks. And I was wondering if the INRB has been approached for the sharing of genetic material, and how different it is from sharing the sequences in your experience, or if you know of any cases of the difference from the operational side.
Yes, so far I think we've been approached by different scientists, and as I said, we are open to collaboration with every scientist. During the first days, it was a bit challenging for us because we were focused on the outbreaks. So sometimes answering or responding was also delayed somehow, but thanks also to the other partners we are working with, who have been able also to relay some of the requests that were made. And now we've established a system on which we can easily share using a MTA or a DTA, so a data transfer agreement or a material transfer agreement. We've already worked on that, and that's how we are working with many teams. And I think you saw my acknowledgements, slides. So we work with many partners, and we know that there are a lot to tackle with this Bundibugyo virus, which is not very known, and we need everyone to provide his expertise to be able to do with that. So we are open to share material, to share genome, but we need just to discuss on the aim, and also to ensure that we are strengthening local capacities. Over.
Super, thank you very much. Thank you for the intervention. And I wanted to ask some similar question to Stephen, specifically regarding the discussion within the team of how you came to the decision to share on Pathoplexus using the restricted use terms in particular. What kind of discussions you had about different options within your team? Over. Stephen, I'm not sure if I...
Sorry, Adam, come again.
Yes, some similar questions as I just asked Eddie. But I wanted to have more granularity kind of on the discussions that you had within the team, how to share the data. What were the different options available to you? And why did you decide for a particular modality of sharing the data? If you could just give us some, like a lot of our audience consists of policymakers and diplomats, and I wanted to our audience to have an insight into the discussions within the team of how to share the data.
Yes, thank you, Adam. Yes, so on what guided on the how to share this data. Yes, I think some of the things I'm going to just be almost what Eddie has just shared. Yes, yeah. And the thing is, yes, we know that our sequence has just been shared with restricted use. However, this does not mean that someone has no access to this data, right? Yeah. So, and like as earlier Eddie said, so why do we need to share this under restricted use? First, some of the things that I've already mentioned in my earlier presentation, that we need support. We need also representation, fairness to these labs that have really generated this data. When we generate this genomic data, I think in one of my presentations, I showed that when we look at this genomic data, it is not just from sequencing and maybe a few tweaks around the bioinformatics analysis. However, there is a lot of things that have happened, and there are many other investments that have been put across. I would give an example when we have the current Ebola, Bundibujo Ebola outbreak. When you look at the time, from the time we got the actual sample to the lab, yes, you have different personnel that are involved. You have hub riders. We have a particular lab that received these samples. So all these HR are being invested in by the government. So at the end of it all, and if one gets this data and they just use it without also the original generators of this data benefiting from the findings, it is really very unfair. So, and also given that we have all had the restrictions that have been happening in different countries. So in one of my points, I mentioned that governments have to guide communication. So whoever is using this data, when you share with restricted use, there's also a bit of it calls for dialogue between the data generators and whoever wants to use this data. So remember, there are some few things that sometimes might not be shared with this sequence or the genome. However, when you have dialogue with the generator, you will end up uncovering all these. And I would also share an example that we've had. Like earlier, Eddie said, we are collaborating with DRC, but there are many dialogues that have been happening between Uganda and DRC. So this really protects whatever information that we are going to communicate. Much as we are doing science, communication is also important. So it's not all just saying that, you know what, Uganda has an outbreak or DRC has an outbreak. How we communicate is very relevant. And when you have this under restricted use, there's also, it calls for that such kind of dialogue. And in case there is any more information that is needed from the data generators, it is easily got than when this data is sometimes just openly, more so at the start of the outbreak. Yes, and maybe did you also ask that what guided us on sharing it with Pathoplexus?
Yes, please, if you can.
All right, yeah. So with that, I think in one of the things, first of all, we are also collaborators with the Pathoplexus team. Yes, and it would also serve the purpose. We also use data from Pathoplexus, and personally, I have found it important that they have got all this viral data in a common space. So one, I find it important that it prevents duplication. So I feel like I trust whenever I look at whatever virus they are covering on their scope, I'm ever more confident to use that data because I believe there's a lot of curation that has happened. By the time the data comes onto the platform, really it is well trusted, and also reduces on the time that you would. I think we know that every now and then there are any other databases that are coming up, but personally I've found that you find that all this data they have tried to collect from different databases, and it is all linked within Pathoplexus. And besides that, when you find it in Pathoplexus, they do not scrap off the earlier submission from other databases, so you can ever trace it back to any other earlier database. Is there anything I've missed to touch on?
No, that's great. Thank you very
All right.
much. And
All right,
I also
thank you.
see some, thank you very much. And I also see some questions on the chat. Isabella, there are multiple questions and I'll try to frame them in this way. Maybe if you could elaborate more on the role of virological.org in your community. And specifically two aspects. One, the biosecurity element. Is there any risk with sharing this pathogen data openly? And if it happens often in the community. But also, I just see what Eric wrote on the chat. Whether there could be some limitations. I guess that applies more to the restricted use. Or maybe this part we will leave to the Pathoplexus team as we discuss. So for now, I just want you, Isabella, to focus on the role of virological.org and the any biosecurity concerns with sharing it openly. Over.
Yeah. Well, I mean, I think most important is that this is not a new virus. So you find many such sequences on GeneBank and somewhere else, just not from this ship, but from the endemic countries. So I think there is nothing unusual about the sequence that would now pose a risk. And as I said, you will also find these sequences on GeneBank. You also find Ebola sequences. So just having a sequence available per se, I think is not already considered a biorisk. I think it's rather, like from a public health point of view, we want to know with what we are dealing with. No, I mean, the worst would be not to have this data publicly and then maybe have a new pathogen or something that has changed. And then this information would not reach the people who are in charge of the response in time. So no, I think this is not really a risk.
Yes, and maybe if I could ask you, from your perspective, if there were any restrictions imposed either through the government, through implementation of international rules, what would you see the problems for your perspective as a scientist on restricted access to data, for example, behind kind of siloing of data or requiring, for example, registration? Do you see it as a obstacle, or can you live with that in your daily practice?
So in this case there was no restrictions for us, but of course the point on ethics is very important. So we have to make sure we do not upload raw data, we do not upload human DNA reads. We also are very careful with metadata. So I know during COVID there was this discussion at some point that GIS-8 sequences should have metadata, but for example we are not allowed to share that. So we would not add age or sex or things like that. So I think this is an important point. You may want to have this data for some analysis, but then on the other hand, you are not allowed to do that. I mean, I think in general, the risk is a bit, not the risk, but the issue may be that countries may not be happy to declare that something is circulating in their country because for whatever reasons, maybe they are afraid that they get blamed for something, or they are, I don't know, less attractive for travelers. So I think there are many negative aspects and for a country to announce that. And I think it's something we should openly talk about, that we should rather incentivize people. So we should rather praise those countries who make their data public because they help to protect the whole world, and to say, oh, this country has this and this outbreak. So, and I think it's also important, let's say, for example, these border closures. So it's something that comes up again and again when there's an outbreak. And I think we know now it's not a good way to stop outbreaks to close borders. So you're rather making things worse. So I think there are some learnings from that go beyond the pure pathogen sharing in that field.
Thank you very much. And just a very quick follow-up out of curiosity. We are both in the Swiss academic system. Do you, under the funding mandates, are you obliged to share open access, also the pathogen data?
I think for SNF, we are obliged to publish open access for the path, and then usually it's more the journals, I would say, who require you to upload the raw data. So it's more when you publish that the journal. But well, you can know. I mean, we would not upload like the raw reads where do you have to still the patient DNA, so you can find the balance.
Super. Thank you very much. Super interesting. And then we have 7 minutes left, and we have a full chat of questions to Pathoplexus team. So I kind of let you decide what you want to clarify, but I just wanted to point to one specific question. The kind of tools you have to make sure the restricted use is really restricted. How do you, so I understand that on the commercial front, that's not really you don't have the capabilities to track and trace upon the commercialization. But what kind of tools you have, for example, to monitor what's happening in the journals, what's happening with the data? If you can start with that and then maybe address any of the many questions that were posed to you, Emma, Chaoran, I let you decide how you want to go about it. We have around 6 minutes, but of course, happy if you can provide us with some information.
Yeah, I can maybe jump in, and of course, if Karan has something to add, he can jump in as well. We've tried to keep up with the questions in the chat, but we're doing our best. With regard to how we kind of keep track of whether restricted use is being followed, largely we depend here, or I guess primarily we would depend here on the submitters. So if submitters see a publication, like let's say there was a publication that came from Switzerland and it's all about the DRC sequences, or the Uganda sequences, I think, Stephen and Eddie would reach out to us and say, hey, what's going on? Obviously, in the first instance, we would reach out to those other authors, find out, maybe they misunderstood, maybe they would like to include, do a joint analysis and be part of a larger paper. In the worst case, we would ask the journal to retract the paper because we can show that they have not followed the terms of use for accessing this data. We luckily have not faced that scenario, but we have been in touch with journals about kind of preemptively letting them know about the terms of use on Pathoplexus. And in general, they have been very open to hearing about this because they also recognize that there is more that they can do to make sure that there is kind of equitable use of data in the publications that they put their stamp on. One of the other ways that we can monitor, though, is that we have a way that when you use sequences, you can put them in what we call a seq set, which is essentially a list of all the sequences you've used in your analysis. You can generate a DOI for that, which is a document identifier that's commonly used in publications. And when you put that in your paper, it actually allows us to track the sequences that are used in that paper. And this, we've just put this out. It's a recent feature. You can now see the publications that are using certain data. So we can actually see this now directly on Pathoplexus. Of course, we're not checking every sequence every day, but we do now have a way to link the sequences that are being used to publications, which of course also helps the sequence generators to see where their data is being used and to let us know if they feel like it's being used in a way that violates the terms.
Super, thank you very much. Charan, would you like to add anything?
Nothing in particular. I think this was, covering everything. Or the tiny point is in the academic world, with journals, it is very normal that you have ethical rules, that you have citation rules and so on that go beyond maybe like normal legal requirements. But in science, it's very normal that you have to cite if you get the user knowledge of someone else, and this is just a part of the ethics. And journalists and reviewers are supposed to check this. And we believe that this also applies to data use. You have to basically adhere to those use terms, to ethical rules of using the data. And we hope and believe that reviewers and journalists would check this and support that as basically a community-wide enforcement.
So I see Nitin asked on the chat if the restriction without limiting open availability for preventing scooping is justified. Could you have registration and data access agreement for the purpose of securing benefits for provider countries? Could it also be justified? Maybe Emma, because I remember we had this discussion. You actually started by thinking about having a registration-based system, but then you came to different conclusions when founding Pathoplexus. If you could just answer this Nitin's question.
Yeah, so it's a good point. I know I sometimes do tell this story at IGWIG that when we started Pathoplexus, I actually very much was in the team or on the side of believing that we should have a closed system, that we need user registration. But as we really thought about this and talked about this, it immediately becomes apparent that it's something that's fairly easy to say, and I do want to emphasize, like, I believed in it, and so I think it's also very intuitive. If you want to keep something safe, you lock it away. But this becomes really hard to do in a way that it isn't pretty easy to get around. So for example, this means that yes, you can just have an account, but anyone can make an account. I'm sure everyone here has multiple email accounts. So just having an account is not enough. Anyone can make multiple of them. You can lie about who you are. Of course, then you could say, well, you're going to verify identities. But this, of course, is also incredibly time consuming and difficult. So you need to then say, what are we going to ask for? Are we going to ask for IDs? Are we going to ask for passports, credit cards? This is possible, but it takes a lot of infrastructure, a lot of time, a lot of people time to check this, or money to pay someone else to do it. And it inherently can disadvantage exactly the type of people we're trying to extend equity to. So not everyone has a credit card. Not everyone has an identity card that fits the EU or the US standard. And so, of course, I am fairly confident I could pass the verification system. I'm very privileged. I have a passport, a credit card, multiple driver's licenses, a residence card. But I don't worry about me getting access. I worry about others getting access. And then finally, even after you've done all of this, someone else can access an account. Someone can use someone else's credentials, either allowed or not allowed. And once that person has downloaded that data, they can also pass it on to someone else. They can, and that might not be done in a bad way. They might pass it on to their PhD student or to their colleague who didn't have a credit card. But the truth is that it's very hard to promise that only those people will be able to access that. The next thing I want to talk about just briefly is that it also then implies, if you have a closed system, it implies that you can't use that data in the open, because only registered users should be able to know about that data. And so exactly the type of use that we showed in our presentation, being able to talk about a worrying variant, a new mutation that might be concerning, a primer scheme that people can use to generate new sequences or even diagnostics. You can't talk about this in the open if that sequence is behind a registration. And so you immediately cut off as well the ability to have that kind of open dialogue, to talk openly about the data, to share phylogenetic trees, to share that kind of sequence information, whether there's a mutation or not, all becomes very gray about if you're supposed to be a registered user to access that, what does that mean as far as open dialogue? So I think for us, it became very clear that And as I said, I believed it. I don't want to, I think it's a very instinctive thing to think that locking things away keeps them safe. But what it can also mean is it's very difficult to do in practice. It can restrict access to exactly the type of users that we're trying to extend equity to. And it can mean that we put huge brakes on the ability to have open science communication, open access, and quick communication, which is exactly what we need in times of outbreak and public health.
Thank you very much. With that, we reached the end of the webinar. Thank you for these questions. Of course, this is what happened in the recent outbreaks, how the data was shared. The discussions at IGWIC will have to take that into account, but also look to future-proof the instruments. And there are many, of course, different perspectives on these topics. The discussions continue. And without further ado, please have a look at our publication now shared on the screen. But I also wanted to take a moment to help our team at Governing Pandemics at the Global Health Center at the Geneva Graduate Institute, in particular, Diana Jalea, without whom this webinar would not have happened. Diana was working behind the scenes very hard to make this happen. And thank you to the wonderful panelists for sharing their knowledge and practice. Thank you very much. And I look forward to seeing you soon in Geneva, probably at IGWIC.